Are you still prescribing ivermectin? Ivermectin, excuse me.
When somebody's acutely ill, I do help people when they need it. So yes, when patients are acute, no other doctor will help them. In the middle of a pandemic, why would I not help somebody? That's an oath and a calling I took.
Do you know, ballpark or even a specific number, how many you prescribed with ivermectin?
Couple hundred.
Okay.
And 95% have been better in 24 to 48 hours. And the others started later in their course. None of them ended up going to the hospital. Nobody's died. And that's a really good track record for COVID in high-risk people.
Well, there's a whole investigation by the Washington Medical Commission into complaints that say otherwise. That was Dr. Ryan Cole, a clinical pathologist, on August 17th, the day he was appointed to the Central District Health Board as the lone physician on that board. A controversial appointment, to say the least. Dr. Cole owns Cole Diagnostics in Garden City, a lab that runs tests on all kinds of things. And his specialty is dermatopathology, which is studying skin cancer through a microscope. But during COVID, he's taken it upon himself to prescribe the anti-parasitic drug ivermectin to patients because, as you just heard, they couldn't get that kind of help anywhere else, he says. Probably for good reason. Ivermectin hasn't been FDA or CDC or even WHO approved to treat or prevent COVID-19. In fact, all three of those have advised against it. It was shortly after that interview, the last time Dr. Cole has spoke with us, by the way, shortly after his appointment to the CDH board, several agencies, physicians, and members of the public filed complaints against the pathologist with both the Idaho and Washington medical boards, two of several states where Dr. Cole is licensed to practice medicine. The Idaho Board of Medicine could only tell us complaints had been filed against Dr. Cole. However, they wouldn't confirm if there was any kind of investigation into those complaints taking place. Meanwhile, the Washington Medical Commission not only confirmed there was an investigation, but provided us with the complaints per a public records request. There were 5 of them, all submitted within a month of each other, between the end of August and the end of September. And those complaints are based on Dr. Cole prescribing a parasitic drug to fight a virus and what he has said about the COVID-19 vaccine. And they contain hundreds of pages, including paragraphs that contradict what Dr. Cole told us in August, that none of his patients were hospitalized or died after he prescribed ivermectin. The first complaint was submitted on August 28th from the VA Medical Center in Boise. The complainant said a colleague with St. Alphonsus Regional Medical Center had a patient who had been prescribed ivermectin by the respondent, Dr. Cole, and had died. The complainant said the doctor had significant concerns over Dr. Cole's rhetoric and his prescribing of ivermectin, and referred to him as a threat to the public with his misinformation. Specifically, Dr. Cole claiming that COVID-19 vaccines cause cancer and are ineffective. Another complaint, submitted the end of September, contained 4 affidavits from Treasure Valley doctors. One, an emergency medicine doctor who treats COVID-19 patients at St. Alphonsus and the VA Medical Center. This doctor wrote in the complaint, "In taking medical history, I am told by some of these patients that they are taking ivermectin for the prevention or treatment of COVID-19. For many, upon the advice or prescription of Dr. Ryan Cole, who they trusted for medical advice due to his warnings about taking the COVID vaccine or his recorded lectures touting the dangers of the vaccine and the effectiveness of ivermectin. Many of these patients now present with severe COVID-19, and some require hospital admission and critical care services. These patients," they went on, "are quite surprised to learn that ivermectin did not prevent or cure their COVID infection, and are contributing to the hospital capacity constraints by relying on disinformation perpetuated by Dr. Cole." Another affidavit from an emergency room doctor at St. Luke's, Boise. "Some of my patients inform me they are taking ivermectin for the prevention or treatment of COVID-19. A substantial percentage of them tell me it was prescribed or recommended by Dr. Ryan Cole, whom they have trusted for medical advice." And there was a complaint filed by the American Board of Pathology saying they had received multiple complaints about Dr. Cole, accusing him of spreading disinformation, advising against the COVID vaccine and masks, and giving advice that promotes the transmission of COVID-19. He purportedly has made statements that vaccines are fake, that they lead to cancer and autoimmune diseases, a clot shot, needle rape, and a human experiment, even though the Pfizer vaccine has been fully approved after rigorous safety and efficacy trials. He has advised patients to take hydroxychloroquine and ivermectin without scientific data to support their use in the treatment of patients with COVID-19. We also received an allegation that Dr. Cole may have provided prescriptions to patients in the absence of a physician-patient relationship and without sufficient medical record keeping. Now, the two other complaints, one a physician in Washington, the other who didn't say from where. We are not revealing the names of those who filed these complaints based on the fact they are considered whistleblower complaints. But because of them, the Washington Medical Commission has authorized an investigation that began on September 17th. 5 days later, Dr. Cole was notified of the investigation, and he was given a redacted copy, several redacted copies of the complaints and every which one that was turned in. We did reach out to Dr. Cole today, but have yet to hear back. It is worth mentioning, in each letter informing Dr. Cole of a formal complaint, the investigator with the Washington Medical Commission points out, when my investigation is complete, a panel of commission members will review it and determine whether to move forward with disciplinary action or close the case without taking further action. A majority of our investigations are closed without further action after this review. If the panel finds evidence of unprofessional conduct, they may take further action, he said. This investigation, we're told as well, may take several months to complete, depending on the complexity of the case and the ability to gather information. So we may not know what happens with this case against Dr. Cole, if anything, for a while, and maybe not without another public records request. We'll just have to wait and see. We do know Dr. Cole took part in today's regularly scheduled CDH meeting, although he was not there in person.